So hello, everyone. My name is Jade Wierks, and I am an MPH candidate with the University of Victoria. Today, I'm going to be sharing some of my experience and learnings from my practicum in developing project management and planning resources for an action within BC's Age Forward strategy and three-year action plan. I was privileged to complete my practicum with the Injury and Clinical Prevention team with the Ministry of Health, and I'm looking forward to sharing some of my information with you over the next 10 minutes. Before beginning, I wanted to acknowledge that I am presenting from the traditional, ancestral, and unceded territory of the Stalo people, in particular the shared territory of the Chiam, Stahelis, Scowlets, and Seabird Island people, what is colonially known as Agassiz, BC, where I get to live, work, and play and raise my family. So very, very grateful for that. I also just wanted to take the time to acknowledge some of the key people involved in my practicum experience over the past 7 months. So to my practicum supervisors, Andrea and Hannah, and the other population and public health staff at the Ministry of Health, thank you for being so welcoming, supportive, and allowing a safe space for me to grow, learn, and share. And to my practicum instructor over the past 2 terms, Dr. Kathy Worthington, thank you for your wisdom in navigating and supporting my practicum culminating report and presentation. So taking a step back to set the stage for the action in which I supported is looking at the issue of frailty and fall prevention for older adults. Falls are the leading cause of injury-related deaths, hospitalizations, and loss of independence amongst older adults in BC aged 65 years and older. The risk of falls and fall-related injuries increases with frailty and contributes to preventable emergency room visits, hospitalizations, and long-term care or assisted living admissions. With the population of older adults in BC expected to reach 1.5 million, so which is 21% of the population by 2043, frailty and fall prevention initiatives are an essential public health domain to address. Further, it is important to consider frailty and fall prevention for Indigenous older adults and elders. Indigenous peoples continue to experience higher rates of chronic conditions at younger ages in comparison to other populations due to ongoing impacts of colonization, intergenerational trauma, and racism. A chronic condition diagnosis highly correlates with an increased level of frailty, and further, frailty research from Indigenous perspectives is limited. Western frailty perspectives focus on the physical domain, while culture and community connectivity are essential elements in the prevention of frailty and overall wellness. Primary care and frailty prevention care can be limited for Indigenous communities, and many elders prefer to age within their community. Age Forward, British Columbia's 50 and over health strategy and 3-year action plan, was released in September of 2024 and is a targeted and proactive approach to aging. It is a prevention-focused strategy with the aim to increase the number of years people live in good health. Within this document, actions are included to ensure current funding supports the needs of older adults and sets the stage for future investments. So taking a deeper dive into the Age Forward strategy and 3-year action plan is a specific action of 1.2.1. This action states to explore the opportunities to expand the Indigenous Elders Activity Program. To deliver on this action, 2 components were identified. The first component is engagements with all of the BC health authorities to support knowledge sharing and consider feasibility for potential expansion of the program. The second component includes the development and creation of a process guide and evaluation framework for the current Indigenous Elders Activity Program by a hired external contractor. So what is the Indigenous Elders Activity Program? The Indigenous Elders Activity Program is a collaborative program between the Health Authority Fraser Health and Indigenous communities or organizations in the Fraser East region of British Columbia. The program supports Indigenous older adults and elders through community-led activity programs that encompass cultural, social, physical, emotional, and cognitive wellness. The goal of the program is to keep Indigenous elders and older adults happy, healthy, and able to stay in their homes and in their communities for as long as possible. My practicum focused in on developing a portfolio of project management and planning resources for this action, 1.2.1, which are included on this slide. This included a project initiation document, a project charter, project management framework, qualitative data analysis plan, a Gantt chart, engagement plan, a decision log, an engagement 1-page overview, a slide deck about the program, prompt questions, and a report template, and establishing and chairing an advisory committee and developing a terms of reference for that advisory committee. For my presentation today, I'm just going to focus on discussing two of these resources in some more detail, the Project Management Framework and the Qualitative Data Analysis Plan. To construct a project management framework for Action 1.2.1, the first step included an evidence review of project management frameworks for public health. Upon review of relevant articles and gray literature, 3 frameworks were identified throughout varying contexts to consider: waterfall, agile, and hybrid. The waterfall approach is linear or sequential, where each phase and components of phases of the project must be complete before moving on to the next step. The agile approach is incremental and iterative that allows for flexibility, changes, and input from many different individuals during each phase of the project. The hybrid approach is a mix of both waterfall and agile, either in terms of which stage of the project utilizes waterfall or agile, or utilizing a waterfall approach for the big picture of the main project, with sub-projects utilizing an agile approach. Step 2 involved identifying the most appropriate framework and adapting this for Action 1.2.1. With this in mind, the hybrid framework was chosen due to the ability to utilize different project management approaches within different phases of the project and to account for the flexibility yet required approvals needed within the project. Further, it was imperative to utilize a knowledge-based view approach as the foundation throughout the project, which I'll go into some more detail on the next slide. So this diagram shows the developed hybrid project management framework throughout the life cycle of Action 1.2.1. The waterfall approach was used for research and analysis and initiation, as the Ministry of Health has procedures to ensure these documents are created in a sequential order and obtain the proper approvals from leadership. This project involves working within large government agency parameters and requires feedback and flexibility from numerous partners and constituents involved. Therefore, the planning stage encompasses both waterfall and agile approaches. Planning documents, resources, and essential deliverables were developed and approved prior to the start of implementation. However, space was left for additional project planning and resources or adaptations to continue throughout the duration of the project. For the execution of the project, the agile approach was utilized due to the ability to make changes, receive feedback, and allow for flexibility in project changes or adaptations, such as input from key partners. Utilizing an agile approach is necessary for the ability to adapt quickly, effectively, and allow for flexibility in the project initiatives. For the closure of the project, a waterfall approach is used for final approvals and sign-offs to ensure all project requirements are met and documented appropriately. Throughout the project, a knowledge-based view approach was utilized as a foundation. A knowledge-based view is rooted in a project leader's ability to utilize their practice, wisdom, knowledge, and experience to navigate complexities and contexts of a project. Utilizing knowledge-based practices complement other approaches to managing and implementing projects, but are also foundational and key factors that allow for unknown complexities to be addressed in a flexible and innovative manner. The second resource developed for Action 1.2.1 is a qualitative data analysis plan for the component of Action 1.2.1 that includes the engagements with all of the BC health authorities to support knowledge sharing and consider feasibility for potential expansion of the Indigenous Elders Activity Program. From these engagements, transcripts or meeting notes would be available, and thematic analysis would be utilized to create a summary report. To conduct this thematic analysis, I developed a thematic analysis plan that includes an overview and process. So here's an image of the overview of the thematic analysis plan for Action 1.2.1. The first step is familiarizing oneself with the data by reading through the transcripts, rereading as needed, and selecting quotes or statements from the transcripts that bring the data to life and represent different viewpoints and patterns. The second step includes identifying keywords from the statements that encapsulate participants' experiences. Third, from the identified keywords, codes would be applied to linkable keywords. The fourth step includes creating themes by first generating potential themes by looking over the codes and identifying patterns. Next, the generated codes would then be reviewed and see if they link back to the keywords and adapt as needed. Following that, it is important to define the theme and rename the theme as needed to match the definition. And the final steps includes utilizing these themes to write the summary report. This image just shows a different kind of perspective of the process of the thematic analysis plan that was previously described. So as you can see, first statements are chosen from the raw data, and then keywords are identified from this data. Next, the codes are created from linkable keywords, and then themes are created that define a group of codes. And lastly, these themes are utilized for the summary report. So during my practicum experience, there were many identifiable strengths and also some challenges that I had to navigate and learn from throughout my journey. Some of the strengths included increased knowledge about project management frameworks applicable to health settings, experience in project management document and resource creation, experience in writing government-specific documents, and experience in beginning to work through a project life cycle within a public health context. And some of the challenges to navigate and learn from included project management during the interregnum period, so during the time of the provincial election in October, project management for exploratory projects where certain outcomes and future directions may not be fully known, and planning engagement with many different partners and organizations. So to conclude, some implications of my work and learning through my practicum is that continuing with innovation, evidence-informed practice, and leaning into exploratory projects like the Age Forward Strategy and 3-year action plan is crucial in advancing fall and frailty prevention. Furthermore, the field of project management will play an imperative role to create change in fall and frailty prevention. And lastly, future research needs to focus on the functioning and management strategies of project leaders in exploratory projects specific to public health in general, as there's a lack of research in this domain. And thank you. And thank you for listening and open to questions.